Michelle Neske, the Posh PA, and today we're talking about what specialties you can work in as a PA. Now, you may have some questions about if PAs can work in certain specialties, and so I'm going to break it down for you today, and you may be surprised at the answer. But if you haven't already, smash the subscribe button. You know I'm here every week dropping new tips to help you get into PA school, become a successful student, and a fulfilled practicing PA. Okay, so one of the biggest appeals of the PA profession is that in the education model, we are trained as generalists. What does that mean? That means that PAs can practice in any specialty across the lifespan. That's right. Surgical specialties, surgical subspecialties, primary care, internal medicine subspecialties, really any specialty that you want. And you don't have to undergo additional specialty training to be able to do so. Now, there are some PA fellowship programs out there that if you are set on a specialty when you graduate from PA school and you want to get more expertise in that area, you can do a one-year fellowship in, let's say, emergency medicine or critical care. Those exist out there. Do you have to do them? No. You can be trained on the job to work in any specialty. And if you so desire, you can change specialties throughout your career. For example, I changed from internal medicine to a very short time in GI into oncology, where I have been for the last 18 years. So you can change specialties without any additional certifications or training as well. A lot of times I get the question of, can PAs work in surgery? Absolutely. PAs can work in general surgery as well as surgical subspecialties. In fact, data from the National Certification Commission on PAs, the NCCPA, from 2021 showed that over 18% of PAs are working in surgical subspecialties, with the most common being orthopedic surgery, cardiovascular surgery, and neurosurgery. In addition, about 24% of PAs were working in primary care or primary care related fields like family medicine or internal medicine, and in internal medicine subspecialties. And the most common in internal medicine subspecialties were cardiology, dermatology, and oncology. Yay, oncology, right? So you can really work in any specialty. Can you work in pediatrics? Absolutely. Can you work in pediatric surgery or surgical subspecialties? Yes. Can you work in pediatric medical specialties? Yes. So you do have the opportunity to work in a variety of specialties because of our generalist training. What does generalist training mean? It means that we rotate through core rotations in the clinical portion of our education, which include all of these specialties. So family medicine, ER, OBGYN, surgery, and many others. Okay, I'm not gonna list them all out, but you also have the opportunity to choose some electives. There are core rotation that every PA program is required to have. And those typically includes the one I just listed, like primary care, internal medicine, surgery, ER, psychiatry, OBGYN, okay? So those are sort of the core ones. In the didactic portion, which is the learning phase of the program and the first phase of the program, you will cover everything, okay? All of the different subject areas, including the pharmacology around them, the anatomy around them, the physiology around them, and the clinical decision making. So you really are getting trained in all of these different areas so that when you go out into practice, you can choose the one that you feel is best for you. And again, you can change specialties throughout your career, which is what a lot of people love about this profession. Is it hard to change specialties without additional training? It can be. So you want to make sure that any job that you transition to, whether as a new graduate or as a practicing PA, that you are getting the appropriate onboarding and orientation that is required for you to feel comfortable and go into practice in that specialty. Typically, most places will have an onboarding system for you, and you want to make sure you're getting that mentorship that you need. There will be some self-directed learning required, as always. But it's important for you when you're interviewing for a job to really make sure that that setup is good for you. I would say an orientation program or an onboarding process should be about 12 weeks. So that's also important to know. Over 70% of PAs work in a hospital-based setting or a clinical setting. And so those are the most frequently places you'll see PAs most frequently. So outpatient clinics and in hospitals. PAs can work in free clinics, and any other healthcare arena, including telemedicine as well. Telemedicine will depend on your state laws in whichever state that you are practicing in terms of your scope of practice. As far as surgery and surgical subspecialties, what can PAs actually do in that arena? Well, you can serve as a first assist with a surgeon, and based on your scope of practice and time with that surgeon, your responsibilities will vary. It also depends on if you're working in an academic setting versus a private setting. Surgical and surgical subspecialty PAs that work in a hospital-based setting where you're in an education center where a lot of residents and fellows are being trained, you're gonna have minimal time in the OR and spend most of your time on pre and post-operative care of the patients, whether in the hospital or in the clinic. So that's really important to know. If you're somebody that really wants to be in the OR, in the operating room as much as possible, then a private setting may be better for you because you're not in there with residents and fellows that are required to get certain amount of procedures for their training, okay, as a practicing PA. So important to know when you're applying for any surgical positions that you want to know if there is OR time, how much OR time, how often you might go there. In the private sector, you may be in there every other day, okay? You may be the right-hand person for the surgeon. So it's really important to know what your role is going to be like there. And that also applies to OBGYN if you're going to be doing more of the gynecological procedures versus the OB area. So important to know what the practice structure is like in those specialties and where you might spend your time, because you don't want to be like going for a surgical position and be like, oh my God, this is great. I'm going to be the OR, I'm going to be suturing, I'm going to be all these things, and find out that most of your time is actually spent in the pre and post-operative setting. If you are happy with that, that's amazing. If you wanted more OR time, I would seek something in a private setting, which might give you more exposure. The same thing for internal medicine subspecialties. Obviously, your practice setting is going to vary. However, your responsibilities as a PA are going to remain pretty much the same, whether you have trainees with you or not. So I think it's important to know that in any of those specialties, you do want to get trained. For me, an onboarding process for my oncology job was about 3 months. There was a lot of medications and a lot of things that I was unaware of coming into the practice, and it takes a lot of time, question asking, being humbled, and self-directed learning to be able to get comfortable seeing those patients. I promise you will over time, but it's important to know that you can really find a specialty that works for you and where you are in your life. I have had many colleagues who have transitioned from working in surgical subspecialties into urgent care, where you're doing more shift work as they've grown their families or as their personal lives have changed. And so that is unique about the profession in the fact that you can switch based on your life circumstances and where you want to be. A lot of PAs are moving into the dermatology and cosmetics sector, very popular right now as well, learning how to do all of those different types of injections and injectables in those areas. So make sure you're being trained with somebody who knows what they're doing and can really support you throughout that process, because that is not something that we are learning. While we do learn the anatomy, we don't learn the injectable techniques for that in PA school unless you are doing a dermatology rotation, which I highly recommend that you do if you plan to pursue that specialty upon graduation. You definitely want to get as much exposure if you have an elective clinical rotation as possible to the specialty you think you might go into. Now, do not be alarmed if you don't know what you want to do. I was somebody who went into PA school not knowing what specialty I wanted, and I didn't even really know when I graduated, and that is totally okay. Where there's going to be other students in the class that are going to know exactly what they want to do, and they're going to head towards that path. I had a lot of students come in my class that wanted to do orthopedics, and they went out and graduated and worked in orthopedics. I was not that person, and so I want to reassure you that if you're not certain which area you want to work in, totally okay. You may want to choose something more general upon graduation to really give you a better idea of what areas you like best, what disease types you like treating. So for me, I worked in internal medicine for the first year, and it really gave me an idea of what it was like to take care of patients with different diagnoses. And I really had an oncology background in the past, working as a patient care technician, and I was always connected to that. So when an opportunity became available years later, I went for it. So don't worry if you don't know, you can explore different options. Bottom line is PAs can work in pretty much any specialty within medicine. You just want to make sure you're getting the appropriate training and onboarding so you feel comfortable and develop the career of your dreams as a PA.